Okay, well, Madam Speaker, I rise to ask question 73 of 2017 as appeared on the paper. My question is posed to the Minister for Health and Medical Services. Can the Minister brief this House what the Ministry has done on the outbreak of dengue?
Thank you, Honourable Minister for Health and Medical Services.
Thank you, Madam Speaker, and I'd like to thank the Honourable Member for the question. Madam Speaker and the members of the House, dengue is one of the several mosquito-borne diseases that exist in our region. It is an endemic to Fiji and many other nearby countries. Even countries that are recognized as having excellent mosquito control programs, such as French Polynesia and New Caledonia, have reported recent outbreaks of dengue, which could suggest that the dengue virus and its mosquito carriers have evolved and continue to challenge even the best disease control programs. Madam Speaker, over the last 40 years, the Ministry has recorded dengue fever outbreaks on a 10-year cycle. However, in the last 15 years, this has been reduced to a 5-year cycle. Outbreaks are occurring twice as often as they used to. In a typical year, around 400 confirmed cases of dengue is normally identified by the Ministry. Madam Speaker, given the current weather conditions, the Ministry has noticed a surge in dengue-like and influenza-like illnesses. The classical symptoms of dengue include high fever, pain behind the eyeballs, rashes on the chest and back, headache, muscle and joint pains, and a general feeling of being unwell. The warning signs of severe dengue are restlessness, fast breathing, persistent vomiting, and unexplained bleeding from the gums. Madam Speaker, there is no cure for dengue, but its impacts on individuals can be managed within appropriate treatment. People with symptoms are advised to visit their nearest health centres or any health facilities at the earliest possible opportunity. The key to effective dengue control lies within prevention. Control of the mosquito population and avoiding bites from mosquitoes that may be carrying the dengue virus are fundamental to the prevention of dengue fever infection amongst the population. Source reduction, chemical spraying, biological control, the use of barriers, mosquito nettings, and mosquito repellents are strategies used to control dengue where the disease is endemic. Having said this, Madam Speaker, it is important to note that dengue prevention and control is a shared responsibility. Unless everybody plays their role, dengue will not be controlled. Individuals have a key role in keeping their surroundings larva-free, reducing and removing places where mosquitoes can lay their eggs, and seeking early treatment should signs and symptoms of dengue occur. Individuals, communities, private sector and government agencies need to work together to control dengue. Madam Speaker, last week the Ministry relaunched the Fight the Bite campaign at Tamabua Primary School, and this campaign will roll out across the country to intensify our efforts on a national cleanup campaign. Communication and messaging on dengue prevention has intensified through media campaigns in the past few weeks. Families and communities are strongly urged and advised to take heed of the precautionary measures provided by the Ministry at this point in time. The Ministry's Vector Control Unit, together with the local authorities, are carrying out joint chemical spraying activities against mosquitoes and cleanup campaigns in high-risk geographical pockets in the city and some towns, and this will be an ongoing process. The Ministry has also organized divisional cleanup campaigns in the West, East, North and Central divisions. We have organized those in partnership with other ministries and departments, as well as the municipal councils. Madam Speaker, the cleanup campaign will progress for the next 4 to 5 weeks around the country. Weekly updates on the campaign will be circulated by the Vector Control Unit. Therefore, Madam Speaker, I ask for each Fijian support, attention and action and collaboration in our Fight the Bite campaign. Thank you.
Thank you. Honourable Biman Prasad.
Can I just, Madam Speaker, ask a very quick and simple question? Would the Minister give us an idea of how many cases we've had since January, just to understand the nature of the spread of dengue?
Since this is the statistical nature, would you like to respond now? Thank you. That is statistical in nature, and she can respond to this later on. I'll now give the floor to the Honourable Lorna Eden.
Thank you, Madam Speaker. Could the Honourable Minister advise this House how long the Fight the Bite campaign will go on for, and how can the general public be of assistance?
Thank you, Honourable Minister.
Madam Speaker, as mentioned, the Fight the Bite campaign, there is no time frame to it. We'll continue to carry out this campaign, like I said, with our other partners, especially with the local town councils, till we are able to reach out to communities and eventually decline the number of cases that are mostly reported to us.
Thank you, Honorable Prem Singh.
Speaker, supplementary question. How long does it take to carry out tests to determine whether a person has dengue or not?
Thank you, Honorable Minister.
Madam Speaker, I thank the Honourable Member for the question. It's basically dengue is detected with the signs and symptoms that I have mentioned. And if I can go back, dengue symptoms include very high fever that is not like a normal fever. And when patients present themselves to the facilities, the medical personnel at the facilities will be able to differentiate between a normal fever and fever-like symptoms or dengue-like symptoms that the patients present. And one of the most common things that normally doctors do with the patients who present dengue-like symptoms to facilities is to try to reduce the high fever that our patients normally present with. And that is done with simple paracetamol and sponge bathing patients so that we are able to reduce the high fevers that they have. It is preventable. Like I said, so far we haven't received any cases of death that has been related to dengue. So, like I said, it's preventable. We'd like people to present themselves should they have any dengue or influenza-like symptoms.
Thank you, Honorable Salvador Rondo.
Thank you, Madam Speaker. It is alarming to hear that there's no cure for dengue. So can the Honourable Minister, it's not a laughing matter, Honourable Prime Minister, that's what the Honourable Minister had mentioned. So can the Honourable Minister explain if the medical institutions, particularly the subdivisional hospitals, health centres and nursing stations, are fully resourced with drugs and medicines and equipments and even staff to ensure early detection and treatment? Thank you, Madam Speaker.
Thank you, Honorable Minister.
Thank you, Madam Speaker. Yeah, I do understand it's not a laughing matter, but I did, and I still stand by it, saying that there's no cure for dengue. There's no cure for dengue, but its impact on individuals are manageable, and we request every... Yes, Madam Speaker, we have been able to contain the outbreak of dengue through the campaigns that I've said, but when they present themselves at the health centres, yes, our medical professionals based at health centres are fully equipped to treat the patients who come to the health centres showing signs and symptoms of dengue. Thank you.
Thank you, Honorable Parmachan.
Madam Speaker, the Honourable Minister mentioned about surroundings being clean. And I would just like to ask, how many times do municipal councils and rural authorities carry out spraying, and how long does it take tests to determine whether someone has dengue fever?
Thank you, Honourable Minister.
Thank you, Madam Speaker, and I'd like to thank the Honourable Member for the question. This is an ongoing process, but when the Ministry receives incidences or surge in cases which are like mosquito-borne diseases, especially in this case with dengue, we try to organize our vector control unit. We have a vector control unit that continuously works with the municipal councils to see when and where these spraying campaigns are needed.
Thank you. And lastly, Honourable Vande.
Yeah, my question to the Minister, what sort of technical and professional capabilities our medical hospitals and staff are prepared for these outbreaks? Thank you.
Thank you, Honourable Minister.
Madam Speaker, I thank the Honourable Member for the question. I think our medical facilities and staff are fully equipped in terms of knowledge and resources to counter endemics like dengue in Fiji.
Thank you.